with laser surgery having several advantages, being less invasive, being safe, less bleeding, less bruising, one of the questions I get is why don't all surgeons use a laser? And it's really interesting. There's two big reasons, in my opinion. One is the cost of the equipment, if you have your own surgical facility, is prohibitive if you don't do a lot of surgery. Some people only do surgery occasionally. Like, for instance, if you're a general plastic surgeon and you're doing lots of body surgery and occasionally you're doing facial surgery, you might operate on the eyelids and the face 4 or 5 times a year. Whereas I'm operating on the face and the eye region 15 times a month. So that has a big impact on whether you can get a laser and get good utilization from it. The other is you have to know your anatomy much better if you're using a laser, because with a scalpel, you're making an incision similar to using your knife, and you're cutting something and you feel the drag of the knife, and that helps you know how deep you are. With a laser, you're not touching the tissue, so you have to know all the intricate, delicate anatomy much better because you don't have that tactile feel. So I think that you want to make sure if you're going to have a laser procedure, go to someone that does a lot of it and they do it daily, and it's not something they do occasionally.